Hello, this slide presentation will be on muscarinic agonists and antagonists. Cholinergic drugs are agents that influence the activity of the cholinergic receptors. Most mimic or block the actions of acetylcholine. And you have your cholinesterase inhibitors, which indirectly prevent the breakdown of acetylcholine. First, we'll discuss muscarinic agonist. Bethanechol is considered a parasympathetic agent. It is a selective agonist at the muscarinic cholinergic receptor. In the heart, it causes bradycardia. With the smooth muscle, it causes constriction of the bronchi. In the GI tract, it'll cause increased tone and motility. In the bladder, it causes constriction of the detrusor muscle and relaxation of the trigone and the sphincter. With exocrine glands, it causes increased sweating, salivation, bronchial secretions, and secretions of the gastric acid. In the eye, it'll cause miosis and contraction of the ciliary muscle. Therapeutic uses are for urinary retention and investigational for GI uses. Adverse effects. On the cardiac system, it can cause hypotension. In the GI tract, it can cause increased tone and motility, and there can be an exacerbation of asthma and dysrhythmia in patients with hyperthyroidism. Other muscarinic agonists are listed here. Probably the one that you would see, pilocarpine, is used topically for glaucoma, and that can be prescribed. And then, of course, acetylcholine, which is used for the rapid miosis or pupillary constriction after the delivery of cataract surgery. The principal structures affected by muscarinic activation: the heart for bradycardia, the exocrine glands, again, for the increased sweating, salivation, bronchial secretions, which is why you'd have the asthma attack possibly, and secretion of the gastric acid. In smooth muscle, there'll be contraction in the lungs. You can have the GI tract, increased tone, bladder contraction of the detrusor. Vascularly, you can have relaxation, vasodilation, and hypotension. And in the eye, the constriction and the ciliary contraction. Overactive bladder is also known as urgency incontinence, detrusor instability, and sometimes can't hold it anymore incontinence. Four major symptoms: urinary urgency, urinary frequency, nocturnia, and urge incontinence. Urge incontinence often results from involuntary contractions of the bladder detrusor. This affects 1/3 of Americans, can develop at any age, but is most prominent among older adults. Two modes of treatment: behavioral therapy and drug therapy. If therapy is ineffective, percutaneous tibial nerve stimulation can be tried. Muscarinic antagonists. These competitively block the actions of acetylcholine at the muscarinic receptors. Most muscarinic receptors are on structures innervated by the parasympathetic nerves. Also known as parasympathetic drugs, antimuscarinic drugs, muscarinic blockers, and anticholinergic drugs. Anticholinergic drugs produce the selective blockade of muscarinic receptors. Not all cholinergic receptors are involved. Certain drugs, such as antihistamines, tricyclic antidepressants, and phenothiazine antipsychotics, have prominent antimuscarinic actions. Use these with caution or not at all for patients receiving other muscarinic antagonists because of the side effect profile. So what are drugs, the anticholinergics that are used for overactive bladder? Um, Overactive bladder characteristics and overview. Specific anticholinergic drugs for overactive bladder include oxybutylene, which is Dritapan, XL, Oxytrol. It comes in a syrup and an extended release tablet or a transdermal patch, and also in a gel. First, Dritapan is an anticholinergic agent that acts primarily on the M3 muscarinic receptors. Anticholic side effects are common. Uh, there are drug-to-drug interactions that you must watch out for, and the available forms were discussed on the previous page. There's also a drug called Vesicare. It is not an M3 selective drug, and adverse effects would be the dry mouth and the blurred vision. And you also have to watch for QT interval problems with this drug. So if that patient was on the drug, um, if they have any cardiac problems, I would avoid. If you're not sure, I would get an EKG before you would use it. Simple, cheap to do. Detrol is a non-selective muscarinic antagonist. It does have fewer anticholinergic side effects, but you still have to watch for the QT interval issue. Other muscarinic antagonists are scopolamine. It acts much like atropine. Therapeutic doses of atropine produce mild central nervous excitation. Therapeutic doses of scopolamine produces sedation. Scopolamine suppresses emesis and motion sickness, whereas atropine does not. So scopolamine is primarily used for motion sickness. You'll see that in the patch that you can get many times. You'll see people on cruises with the scopolamine patches on. It's used for ophthalmic procedures and the production of pre-anesthetic sedation and for obstetric amnesia. Another is ipotropamine bromide. It is an anticholinergic drug also. It's used to treat asthma, chronic obstructive pulmonary disease or COPD, and rhinitis caused by allergies or the common cold. It is administered through inhalation or nasal spray routes. It is not associated with the typical antimuscarinic side effects such as dry mouth, blurred vision, urinary hesitancy, or constipation. You have your secretory anticholinergics, and this would be like Rubinol. Um, these help reduce salivation. Commonly seen with patients that have issues with swallowing, maybe stroke patients, some of your severe CP children that drool a lot would be given this to help with that excessive salivation. You have the dicyclamine, which is used for irritable bowel syndrome when they have the spastic colon or mucus colitis, and for functional bowel disorders such as diarrhea and hypermotility. So questions the nurse teaches a patient about botanical, and which statement by the patient requires intervention by the nurse. And the answer is A. The medication should be taken with meals. And that is because the administration with food can cause nausea and vomiting. So it should be administered 1 hour before meals or 2 hours after meals. Question 2. The patient is prescribed butyl for urinary retention. If the patient exhibits signs of overdose, such as increased salivation and sweating, bradycardia, or hypotension, which medication should the nurse administer? And of course, that would be atropine, which is number D. Question 3, last question. The patient who takes Ditropan for overactive bladder takes an over-the-counter antihistamine for hay fever. Which symptoms should the nurse watch for that could indicate toxicity? And the answer here is B, dry mouth, increased temperature, and blurred vision. And that is it for this presentation.